Hi guys, my name is Tim Moen. I'm the leader of the Libertarian Party of Canada. I've been asked by someone to do a video about the libertarian position on universal health care. It's a very touchy subject here in Canada. It's, you know, your first day in political science class. It's made very clear to you that if you want to have any kind of electoral success, you don't challenge the healthcare regime in Canada at all. So I understand this is a very difficult subject for many people. It's a difficult subject for libertarians to talk about in a culture that loves its universal healthcare. It's free healthcare. I put free in square quotes. This is a bit of a longer video. Probably I've written down a bunch of notes, but really the gist of it, the crux of the libertarian argument against universal healthcare, I'm going to put right at the start, and then we'll get into more technical details and address a lot of the concerns about it further on. So the first thing that I would do to address this is I would say that most people just think that they favor universal health care, but they don't actually favor universal health care. Let me explain this. And here's some questions to ask yourself, or that I'll ask you, I guess, to tell if you favor universal health care. The first question is, I'm a healthcare practitioner myself. I'm a paramedic, a firefighter paramedic by trade. My question to you is, would you be personally willing to use violence or threats of violence to prevent me from providing the kind of care to my customers that they want? So would you personally be willing to use violence to stop me from providing care to my customers? Okay, that's question number one. Number two, would you be personally willing to steal money from me and my family to pay for healthcare services for other people? Would you point a gun at me and demand payment? Okay, would you personally be willing to do that? Would you use violence, threats of violence, to get money out of me to pay for someone else's healthcare? The third question is, if I disobey you and refuse to hand my money over to you, if I disobey you and continue to provide the kind of service my customers want, are you willing to escalate force against me? If I defend myself from your aggression, would you be willing to use lethal force? Would you be willing to kill me to stop me from doing that or to get my money? Now, if you answered no to any of these questions, you're not really in favor of universal health care, because universal health care requires taking money without consent from people, and it requires coercing medical practitioners and customers to fit within a one-size-fits-all regime. In other words, it requires legalizing criminality. It says, on one hand, if you as a citizen were to implement universal health care in your own neighborhood, let's say, if you commit armed extortion on your neighbors and threaten healthcare practitioners in your neighborhood with violence for operating against your orders, well, you would likely serve a life sentence, and rightfully so. But when the government does exactly the same thing, we in Canada call that universal health care. We think it's a virtuous act, and that it's noble, and that you're monstrous if you oppose it. I mean, don't you care about people? Don't you care about the poor? Now, let me remind you at this point, I'm a healthcare practitioner, okay? I got into this profession to help people because I want to give them healthcare. And I've operated as a volunteer. I've helped many, many people when I'm off duty for free. I don't ever want to see someone harmed. I don't want to see someone die. I don't want to see someone go without care. And that's how we're wired as healthcare practitioners. That's why we got into this field. We want to help people. But we can look at areas where government controls an industry and compare it to what happens in a free market. Let's take the most important factor for your health, nutrition. In countries where government controls the food production, we see food shortages and starvation. We see long lineups for food. There's this old joke about two women in the communist Soviet Union where the government controlled the food production and distribution in much the same way our government in Canada controls healthcare. Now, these two ladies are waiting in line for hours to get their stale loaf of bread, and one complained to the other, "We've been waiting here for hours, and all we're going to get is a stale loaf of bread. This is BS." The other lady chastises her and says, "How dare you complain? Do you know that in capitalist countries, the government doesn't even provide bread for its citizens?" Now the joke, of course, is that in capitalist countries, instead of lineups of people waiting for stale bread, we have lineups of every variety of fresh bread waiting for people. Food is abundant and cheap here in Canada precisely because the government isn't in charge of production and distribution. Now, those two ladies in the Soviet Union could not wrap their heads around how we can have all this abundance when we don't even have a central authority figuring out how much food to produce and distribute. In the same way, those of us here in Canada can't imagine how healthcare services could be provided without a central authority figure figuring out how to produce and distribute healthcare. So we sit in our overcrowded emerge departments waiting for our stale loaf of healthcare and say, imagine if the government didn't provide healthcare for us. We'd be screwed. But of course, we're just like those two ladies in the Soviet Union. We're immersed in a paradigm. We can't think about how, in a state of freedom, without centralized authority controlling everything, how these things would be provided not only in abundance, but in greater quality as well. Now, at this point, I usually get someone say, "Oh, so, okay, Moen, you want a system like the US?" Because we're taught up here in Canada that the US system is leaving people to die in the street and running them into the poorhouse when they get sick. And the answer to that is no, I don't want a US-style system. The US is far from a free market system. The US government spends far more per capita on healthcare than our own government, almost twice as much, I think. Now that fact alone, the fact that their government is spending more on healthcare than our government, where we have socialized medicine, ought to tell you everything you need to know about that, whether that's a free market system or not. Now, you add in government contracts, piles and piles of government regulation. You know, I read somewhere, I think that over 700 pages of new laws are, regulations are added each year to the US system. You add licensing restrictions that increase healthcare scarcity and an oligarchical, crony, capitalist insurance hegemony. You've got a recipe for a dystopian system of control over healthcare practitioners and skyrocketing healthcare prices. So no, I don't want the US system. You know, this US system regulates in a different way than Canada, but there's all sorts of regulation, control, and funding, and interference. Anyways, so instead what I'd like to do is look at areas where we have what closely approximates a free market. So cosmetic and elective surgeries have increased in abundance and decreased in cost over time. I remember something like 20 years ago, you could get corrective eye surgery, you know, to cure your short-sightedness. They did something called radial keratotomy. Now this was very expensive, only wealthy people could afford to get it done, and it was a clumsy procedure done with a scalpel. But now, lower middle class people can afford to get it done, and it's a quick and precise procedure done with lasers. So it's available to almost everyone who has a few $100s in their pocket. When government is heavily involved, prices go up and scarcity increases. When the government just lets healthcare practitioners off their leash, prices go down and abundance increases. This is just a well-known law of economics, and yet people seem to think that healthcare is somehow different, is somehow immune to this basic economic principles. They aren't. And now at this point, you know, enter the people talking about Scandinavian healthcare systems. And they're trotted out, and people say, "See, Moen, these great there are these great public systems that provide great results. They're some of the best healthcare systems in the world." And yeah, this may be true compared to the oligarchical systems like the US or the straight up socialist systems like Canada. And let's even set aside the fact that the Scandinavian systems have a robust private system that operates in parallel to the public system, that takes a lot of the burden off the public system and provides all sorts of great outcomes and products in the private system. But let's assume that there is a public system out there that provides the best healthcare system in the world. And I don't deny that this is possible, particularly in a nation that has a very healthy free market system in all the other areas and is highly productive. But this doesn't change the fact that it's still immoral. It would be like saying, look at this country that still has slaves picking cotton. It has the best cotton production anywhere in the world. Now, that wouldn't be a good argument to support an immoral system, would it? It wouldn't be a good argument to support slavery. Slavery is wrong because it's immoral to own people. It's immoral to have a claim on their labor and to control them and to put them under your thumb. We should also be highly skeptical that slavery is more productive than a free market. It's likely that the country would do even better if it allowed its healthcare practitioners to be free and stopped stealing from people and stopped enslaving humans. Now, many economists like Ludwig von Mises and F.A. Hayek have written volumes explaining why government ownership of the means of production doesn't work, how it misallocates resources, how it has suboptimal results. There aren't proper price signals. There's a knowledge problem in that the central planners can't possibly know as much as the aggregate of the individual actors in a self-organizing system. And I won't bore you with the technical details. I mean, you can Google that stuff and read volumes and volumes about why socialism doesn't work, why government ownership of the means of production doesn't work. I'll try to put the problem here in Canada in simple and concrete terms for you. As a paramedic, I am prohibited from selling you services. Now, I have a number of innovative ideas and solutions that could help you and your loved one out immensely in your time of need, and it's illegal for me to provide these services to you. You know, I see market opportunities everywhere. Over the last few years in Alberta, code reds have been all the news in Alberta. They've been all over the news. This is when there are no ambulances available to respond to emergencies. They're just tied up. Now, I have two business ideas that could help solve this problem. One is an Uber-style paramedic service where you can get immediate care for yourself or your loved one. Another is a service where we have paramedics looking after patients who have been brought into emergency departments by ambulance. Right now, it is common for ambulances to be out of service for hours while their crews wait in hospital hallways with their patients, waiting to hand them over to the overwhelmed emerge department. Here's another business idea. I regularly see patients who have urgent healthcare needs that could be addressed at home. They don't really need to go into emerge, but because there aren't any services available to provide them at home, they get transported to the hospital where paramedics wait with them for hours in hospital hallways, which takes their ambulance out of service, unable to respond to their community to life-threatening emergencies. And then the patient gets a bit of treatment and a prescription and goes home shortly after they get seen by a physician. So for example, elderly patients who have low mobility, okay, people that maybe are in nursing homes or they're at home and they can't get out, they just can't walk very well or get around. It's common for elderly people to get a stomach bug, and now they have vomiting and diarrhea, they get dehydrated, they get very sick. Okay, these people need medical attention, there's no doubt. Is it a life-threatening emergency? No, probably not. Is it something that can be taken care of at home? Yes. They need some IV fluids, they need some medications to deal with the nausea. And this can be done at home by a community paramedic, let's say. Or often I see patients who have terminal illnesses and they want to die at home surrounded by family. But dying is painful, it's scary, it's messy. And when things get rough and the family gets overwhelmed and doesn't know what to do, they call 911, where often our only option is to transport the patient to the hospital. And then they end up dying in an institution instead of at home where they wanted. Again, a community paramedic service could spend hours with the family and the patient, helping them manage the symptoms and educating them and keeping the patient comfortable so that they can pass away at home peacefully, surrounded by family. Now, I'm prohibited from working for you. I can't start Moen's community paramedic service and provide you that service. My only real option as a healthcare practitioner is to work for the government under their direct control, fulfilling their mandate, which may or may not line up with your mandate when you need healthcare services. Now, if I ignored this prohibition and I just started a service and gave you great value, exactly what you wanted at home, that you're more than willing to pay me for, well, enforcement action would be taken against me. If I continue to disobey and I just do what you want, what you're willing to pay for, what you consent to, then eventually real physical force would be used against me to try and make me stop. If I pushed away the people trying to stop me, these enforcers, if I pushed them away and kept trying to help you, and I defended myself against their aggression, well, they would escalate force to the point of drawing guns. See, laws and regulations are not suggestions. They are mandatory orders backed by force. And that force gets escalated until you either comply or die. Now, I'm one healthcare practitioner. I got into this profession, like I said, to help people. And I've thought of numerous ideas over the years to help people that I am simply prohibited from doing. I'm not allowed to do these things. In Canada, there are thousands and thousands of healthcare practitioners with all sorts of expertise and ideas. And imagine if they were free to enact their ideas with consenting customers. Imagine the kind of healthcare we would have. Imagine the abundance of healthcare services, the competition, the falling prices. It would be awesome, wouldn't it? I mean, just let us off our leash. Let us provide the kind of services we know we can provide. But we can't do that. And why can't we do that? What is the problem? Where does that come in? Who's to blame? Is it Justin Trudeau? Is it our provincial government? Is it incompetent healthcare bureaucrats that just need to be replaced with proper libertarian bureaucrats, let's say? And the answer to all those questions is no. It's not incompetence. It's not one person. There's not a single person or anything to blame. And let me be very clear. This is not an indictment on the people in healthcare. Everyone, all the way up the chain, including the politicians, all have great intentions. My healthcare colleagues and professionals and the bureaucrats and the managers all have great intentions, and they're all very competent and willing people. The problem ultimately is the system. So to understand the problem, let's trace the reason I can't provide services to consenting customers. Well, it's against the law in Alberta to do this. The Alberta Health Act basically prohibits me from being outside the control of the single provider and controller of health services in Alberta, namely Alberta Health Services. They directly control and regulate and fund even contract providers, and there's a few private clinics that do this and that, but again, they're directly controlled by Alberta Health. They're not controlled by their customers. Okay, so you might say that the Alberta Health Act is the problem and we just need to lobby government to amend the act. Well, no, you can't just do that either, because the act is written the way it is in order to align with and comply with the Canada Health Act, which basically mandates that the provinces provide public health care and that they limit private services. Okay, so why don't we just disobey the federal government? What will they do if we just say, screw them, we're going to do our own thing here in Alberta? Well, what happens then is they withhold billions in federal healthcare funds from the province if we don't follow the Canada Health Act. Now, this is money that is taken from Albertans by the federal income tax. Money is then skimmed off the top to pay for administration and bureaucracy, and the rest is lorded over us to make us comply with that Canada Health Act. And if we don't comply, it's not like the feds are going to tax us less, are they? No, they'll just take that money that they otherwise would have sent to us and they'll send it to another province. Maybe they'll send it to Quebec in a provincial transfer or something like that. So the problem then is the Canada Health Act and the income tax. We could just get the federal government to repeal these acts, and then we can keep our money in provinces and let our province legalize healthcare. But good luck getting Canadians to vote to repeal universal healthcare and the income tax. So here is where we run into the insurmountable problem. And the insurmountable problem isn't Justin Trudeau, it isn't healthcare bureaucrats, it isn't the province, it isn't the federal government, it isn't any of these things. It's the average Canadian voter who knows for certainty in their hearts that only a monster would vote against universal health care and against the income tax that looks after so many of us. So to recap, the reason I can't provide services to your suffering and dying mother in her home surrounded by family, the reason I can't make her comfortable and help you find folks out, the reason I can't start a life-saving service that will help you out in an emergency when the government-run service is overwhelmed is because average Canadians think free market healthcare is monstrous. Everyone along the line here has good intentions. Nobody wants people to suffer and die needlessly. But we've been sold a story called universal healthcare. And as Justice Beverly McLaughlin quipped, access to a waiting line is not universal healthcare. Confucius said that the beginning of wisdom is to call things by their proper name. What exactly is universal healthcare? Well, as I said earlier, it's a system that is funded by money taken by force from individuals without consent, otherwise known as theft, or more accurately, armed extortion. It's a system where healthcare practitioners are prohibited from providing the services they and their patients want, and they're controlled by the government instead. And it's a system where a few bureaucrats and politicians decide what is best for everybody. It's a system predicated on violent coercion, and it doesn't even work as well as a system predicated on consent and voluntary interactions. Now, the other thing to consider are the people who are on the margins. Right now, poor people, seniors, the disabled, and other vulnerable populations are trotted out as a defense of universal healthcare. The assumption here, I guess, is that healthcare practitioners will let people die if they don't have money, which is kind of insulting. It's a dumb assumption, considering that healthcare workers are some of the most compassionate and giving people you will ever meet, and considering that even before we had universal healthcare, doctors would look after patients pro bono, or give me a dozen of your awesome eggs, Agnes, and I'll write you that prescription, or whatever you can afford. But my question to people who support this system is, what about all those vulnerable people when the system is eventually overwhelmed and collapses? Right now, the world economy is propped up by a Ponzi scheme of US dollars based on debt and artificially low interest. Eventually, mathematically, a major crash is going to occur, which will destroy wealth and government healthcare funds. Now, who do you think will be the first casualties of an imploding healthcare system? We have one giant point of failure, and we have laws that prohibit healthcare practitioners from setting up practices that would benefit people in the event of an economic crisis. So if you care about the marginalized in our society, you ought to support, at the very least, legalizing healthcare, legalizing private options. Let me and my compassionate colleagues off our leash. My goal is not to take healthcare away from you. My entire professional life, I have been working hard to provide healthcare for people. I'm not scary. Go to libertarian.ca to find out more. Thanks.